তুমি এখানে দাঁড়িয়ে থাকো। ঠিক আছে,
খুব আছে।
এবার ঠিক আছে, একজন এখানে থাকো, চুপচাপ চেয়ার নিয়ে বুঝতে পারছেন?
এটা একটু টানা যাবে?
হ্যাঁ হ্যাঁ নিশ্চয়ই।
হ্যাঁ ঠিক আছে। হ্যাঁ থাক, যদি এতে না চলে খুলে যাবে না তো?
না।
Good evening, everybody. So this is indeed my great pleasure to be here with you to interact on certain common topics which we see in our daily practice. And I'm much thankful to all of you, especially Professor M2U01126 for inviting me to speak on this subject in front of you. So this we know is a very common problems we see in our both hospital and private practice. This is a young 18 years girl came to me with diffuse hair loss just a few months back, and this girl was being treated by various dermatologists by different newer advanced medicine. Even nowadays, you know, a lot of lasers and mesotherapy is going on in dermatology, mostly on commercial basis. This also had been tried, but the dermatologists have seen has missed few clinical clues. So when this girl entered in my chamber, I noticed it is not a actually is well circumference hair loss, it is a patchy hair loss. So the diagnostic clue is very important that hairs are of different length, and this is very classical diagnostic feature of trichotillomania. So this is not a case of at all a hair problem or dermatological problem. It's a purely is a psychiatric problem. So definitely you have to refer the case to you. So another girl, 20-year-old with recurrent erosions of face. This girl also was diagnosed as contact dermatitis, acne, lots of allergies like this. But what struck me, that is actually this very peculiar shape and this biliary margin, that's very unique margin, is not conforming to our any dermatological diagnosis. So this is the diagnostic clue that biliary septate erosions. So this is nothing but dermatitis artifacta. So again, it's a purely psychiatric disease, not a dermatological disease at all, but commonly the patient is coming to us. So actually, skin is a mirror of the both body and mind, and from the skin we can directly read the both physical and emotional status of a particular being. And there are lots of cosmetic advertisement is going on, you know, both commercially and some scientifically. And this skin care culture is indicating the health and vigor. At the same time, it is also a hidden part, that is the sexual attractiveness. And this is mostly patient, even 70 years old, 60 years old, they are coming for different cosmetic problems. So this is indirectly have a probably some unspoken issue of this sexual attractiveness still in this age. And this is probably the media influence. And we know skin is the largest organ of the body. And the problem of a skin disease is that when a person is having pain abdomen and he is consulting a surgeon, is giving some antispasmodic or doing something, the ulcer is there but still the pain is relieved. So the patient thinks it is cured, but not at all cured. But skin problem is that when we see a acne, we cure it, but still the scars or pigmentations are sometimes lingering for a long time. So their patient think that still the disease is not cured. So this is a real problem of dermatological clinical practice. And as it is exposed to environmental environment, so skin has to bear a lot of insult from the external milieu. And any pathology of skin, that's important, even a very small trivial involvement of the skin can give rise to very major mental trauma to a particular patient. And this is commonly we see, more the extensive lesions, more it is chronic, more of longer duration, it is causing more mental impacts. But this I am coming later. We have shown by a recent paper, this is not always true. Even a smaller lesions, even a small duration lesion can cause psychological impact. And what is psychodermatology? Actually here, the interaction between the mind and the body and skin, we can, on that particular light, we can explain the onset, form and progression of a particular skin disease. And this is actually, we should think not a very localized term, we should think it's a broader term where this wide and diverse relationship between the psychiatry and this dermatology, we should know the interaction in various ways, not a very linear relationship this is. And definitely this is the multidisciplinary approach so that we can conjointly solve the problems. And in their countries, a lot of collaborative organization has already been developed, which is unfortunately still not in India. In Europe, there is already European Society for Investigative Dermatology and Psychiatry, that is ESDAP, and in North America, it is the Association for Psychodermatological Medicine of North America. So this is APMNA. But I think we badly need this type of collaborative organization to solve our problems. Now, how we can assess the influence of the psychological, psychosocial and psychiatric factors? Certain disease we know is definitely affected by these psychological factors like psoriasis, lichen simplex, chronicus, prurigo nodularis. I'll show the pictures. These are definitely from chronic stress. This disease is not caused by that, but maybe persistent from the chronic stress factors. Now, certain disorders like dermatological disorders induced by this psychiatric illness, like this factitious dermatosis or this dysmorphia, these are basically psychological disorders, but ultimately is reflected on the skin. And certain disease where the skin disease itself is causing some psychiatric illness, like depression, adjustment can come from a patient if we diagnose vitiligo, very social fact, very social diseases, not so much a medical disease, but cause a lot of depression. Even we have seen suicides and others, especially the younger ladies and us. And there are some comorbidities like alcoholism can give rise to both psychological problems and our dermatological problems. Now, any skin disease, there is a somatic part we know, but definitely there is, even we don't tell it is a psychological or psychocutaneous disease, but still there could be a psychic part of that skin disease because it is a very obvious, it is open, patient can see themselves. So definitely skin disease have always a psychological part. This psoriasis, extensive psoriasis, and nowadays this psoriasis, this acne, now we count by life quality index because we don't cure the disease, we can only control the diseases. So when we think of a particular medicine, whether it is effective, like biologics, the very recent costly medicine is useful in this, we are using even in India, we are counting how much quality of life you can improve. So psoriasis, acne, this type of disease, their quality of life is an important measure or index by which we can assess that disease is being controlled or cured. So this psoriasis, we have done a study, there Dr. Chaudhary was also a co-author. Actually here we have shown the PASI score. PASI score means Psoriasis Area Severity Index. That means it's a very mathematical calculation how the severity of psoriasis is. And we correlate with PQOL12, that is Psoriasis Quality of Life Index 12, the 12 questionnaire set. And in this project, we have shown that no correlation between PASI score and the PQOL score. And this is very interesting observation because normally we think if the disease is severe, that is a normal written in the book. If the disease is severe, quality of life is hampered. But our study showed that no direct reflection of a particular disease severity. What does it mean? That means that even a limited amount of psoriasis, if on a exposed part of the skin, cosmetically unacceptable part of the body, that part we have seen the quality of life is very much damaged. Like biologic so costly medicine, there is British guideline where we can use so costly drug, but in psoriasis they have mentioned, we are also following that if the quality of life index is more than 10, even the disease is limited, we can use that costly drug. Because we have seen some of the receptionists in the hotels or salespersons, they have on the exposed part psoriasis, very limited psoriasis, and they have tremendous mental trauma. So we have to consider our treatment nowadays, not only on the disease part, also the psychological part. This is another disease, lichen simplex chronicus, due to chronic stress, because the nape of the neck patient is continuously rubbing, and this is causing the lichenifications. Lichen-like. So this is ultimately lichen simplex chronicus. Very important cause is here, some chronic stress. This is prurigo nodularis, very common, particularly little aged ladies especially, also certain men. And you have seen this lichenified and chronic itching. The patient suffers a lot. We can do by anything and ultimately sometimes this type of patient we have to refer to you for this psychological stress. Now, what are the common psychopathologies underlying the psychopathology? These are anxiety, depression, delusion, and obsessive compulsion. And this